Our entry for the Public Involvement Award is our story of 6 productive, collaborative and rewarding years working together designing, delivering and disseminating a major research study about how GPs work in emergency departments. From the earliest stages of conceiving our study through to delivering the findings, we have exceeded our expectations, helped by the use of the UK standards for public involvement throughout. Our public contributor colleagues, Julie and Barbara, were involved more often than we anticipated. They took on a wider range of roles than we'd planned for. They looked for ways to improve the public involvement processes and put these into action. They affected the research, amending patient recruitment methods and dissemination, and positively changed attitudes of other members of the research team towards public involvement. To share what we learned, and ultimately to help improve processes and impact of public involvement in research, we published a paper reporting our experiences and identified 10 steps to help research teams effectively involve people in research.